Today, I will be talking about few types of disease or disorders of the nervous system such as Parkinson's disease, spinal muscular atrophy, Duchenne muscular dystrophy, Huntington disease, multiple sclerosis, amyotrophic lateral sclerosis, neuropathy. In this video, I will be only talking about Parkinson's disease and do watch other diseases in other parts of my videos. So let's start with Parkinson's disease. It was first described by Dr. James Parkinson in 1870 and it was known as shaking epilepsy, but later it was named as Parkinson's disease. Parkinson's disease is a progressive disorder of the nervous system. It is the second most common neurodegenerative disease after Alzheimer's disease. The disorder affects several regions of the brain, especially an area called the substantia nigra that controls balance and movement. So what is substantia nigra? It is a midbrain dopaminergic nucleus and it plays a role in modulating motor movement and reward function in the basal ganglia. It is the critical brain region for the production of dopamine. You can clearly observe the difference in dopamine level by observing right hand side image. A small pink dot in normal neuron level is high compared to the affected neuron by Parkinson's disease. These are the few criteria such as after age 50 it is called as late onset disease, before age 50 it is called as early onset disease, before age 20 it is called as juvenile onset disease. So this disease affects more than 1 million people in North America and more than 4 million people throughout the world. These are the symptoms of Parkinson's disease and in short we can call it as TRAP. So tremor means shaking movement and it usually starts on from one side of the body from hand and it can also affect the arms, legs, feet and face. Rigidity means stiffness of the limbs, neck or trunk. Akinesia means loss or impairment in power of voluntary movement, posture and balance. So they won't be able to sit or stand properly. This symptom usually get worse over a period of time. There are currently no blood or laboratory tests to diagnose this disease. Diagnosis can be done with the help of a person's medical history and a neurological examination. Neurological examination is a physical examination done to check sensory and motor neuron reflex. Causes of Parkinson's disease. Most cases of Parkinson's disease probably result from a complex interaction of environmental and genetic factor. Approximately 50% of people with Parkinson's disease have a family history. Familial cases of this Parkinson's disease can be caused by mutations in the gene such as LRRK2 gene, which stands for leucine rich repeat kinase 2. It makes protein called daldarin and active in the brain and other tissue throughout the body. Park7 gene stands for Parkinsonism associated deglycase. It makes DJ1 protein and it is also active in the brain and other tissues throughout the body. PINK1 gene stands for P10 induced kinase 1. It makes a protein called P10 induced putative kinase 1 and this protein is found in cells throughout the body with highest level in the heart, muscles and testes. PRKN gene stands for Parkin RBRE3 ubiquitin protein ligase. It is one of the largest human gene that makes a protein called Parkin. SNCA gene stands for synuclein alpha. It makes a small protein called alpha-synuclein. Alpha-synuclein is evident in the brain and smaller amount are found in the heart, muscles and tissue. Mutation in some of these genes may also play a role in cases that appear to be sporadic. Many Parkinson's disease symptoms occurs when nerve cells in the substantia nigra die or become impaired. Normally this cell produce a chemical messenger or neurotransmitter called as dopamine. which transmits signals within the brain to produce smooth physical movement. When these dopamine producing neurons are damaged or die, communication between the brain and muscle becomes weak. Eventually, the brain becomes unable to control muscle movement. The protein deposit called as Lewy bodies appear in dead or dying dopamine producing neuron. When these Lewy bodies are not present, the condition is sometimes referred to as Parkinsonism. It is unclear whether Lewy bodies play a role in killing nerve cell or if they are a part of the cell response to the disease. Inheritance of Parkinson's disease. There are two different types of inheritance pattern observed in Parkinson's disease, such as autosomal dominant and autosomal recessive. If the person is having LRRK2 or SNCA gene present, then it is autosomal dominant. If the person is having PARK7 or PINK1 or KN gene present, then it is autosomal recessive pattern. In autosomal dominant only, one copy of altered gene in each cell is sufficient to cause the disorder. In most cases, an affected person has one parent with the condition. A person affected by an autosomal dominant disorder has a 50% chance of passing the altered gene to each child. The chance that a child will not inherit the altered gene is also 50%. So it is 50-50% chance. In autosomal recessive, two copies of altered gene in each cell to cause the disorder. If you are born to parents who both carry the same autosomal recessive gene, you have a 1 in 4 chance of inheriting the abnormal gene from both parents and developing the disease. Criteria such as 25% chance that the child is born with two normal gene will be normal, 50% chance that the child is born with one normal and one abnormal gene will be the carrier without disease, 25% chance is that the child is born with two abnormal genes, they will be at the risk of the disease. Treatment of Parkinson's disease. There is no cure for Parkinson's disease, but medicines, surgical treatment and other therapies can often relieve some symptoms. Levodopa is one such therapy or drug to reduce the symptom. Levodopa is also called as L-dopa and it combines with carbidopa. Nerve cells use levodopa to make dopamine. Carbidopa prevent or reduce some of the side effects of levodopa therapy, such as nausea, vomit, low blood pressure and reduce the amount of levodopa. Medicines usually prescribed for Parkinson's disease includes drugs that increase the level of dopamine in the brain, or drugs that affect other brain chemicals in the body, or drugs that help control non-motor symptoms. Other medicines used to treat Parkinson's symptoms include dopamine agonistic to mimic or copy the role of dopamine in the brain, MAO-B inhibitors to slow down an enzyme that break down dopamine in the brain, COMT inhibitors to help break down dopamine, amantadine, an old antiviral drug to reduce involuntary movements, cholinergic drug to reduce tremor and muscle rigidity. DBS is a surgical procedure that surgically implants electrodes into part of the brain and connect them to a small electrical device implanted in the chest. This device and electrodes painlessly stimulate the brain in a way that helps stop many of the movements such as slowness of the movement and rigidity. This all are my reference and I am putting in description so that you can also refer to it. Thank you for watching.